There are millions of struggling families in the US, many of who are experiencing social challenges. There are also hundreds of thousands of social resources and programs out there. And amazing community health workers, promotoras, and representatives can guide and advocate for patients. Unfortunately, the ways in which these groups interact is often erratic, delayed, and cost inefficient. And that's where Pear Suite comes in. Hello, everyone. My name is Colby Takeda. I'm the co-founder and CEO of Pear Suite. At Pear Suite, our mission is to empower community health workers to better assess and address the social drivers of health. And we do this through our social care navigation platform. More about myself, I'm a former senior care executive, previously led policy and partnerships for the Blue Zones Project by ShareCare, and worked in rural and under-resourced communities across the country. So I know the impact of social determinants of health and really want to work to address these. Alongside me is a strong leadership team that have background in technology, healthcare, and workforce development. Food access, transportation, social connections, and health literacy. These are the social drivers of health, and they're critical to improving healthcare equity and access. There are millions of struggling families in the US, many of who are experiencing social challenges. There are also hundreds of thousands of social resources and programs out there. And amazing community health workers, promotoras, and representatives can guide and advocate for patients. Unfortunately, the ways in which these groups interact is often erratic, delayed, and cost inefficient. And that's where Pear Suite comes in. Pear Suite is like a social care navigation platform for community health workers. With our platform, staff can better collect, visualize, understand, and act on social determinants of health data in a culturally sensitive and person-centered way. In addition to selling our care navigation platform, Pear Suite supports organizations with tech-enabled services, offering a variety of options for healthcare organizations and provide social care navigation services that would rather utilize our local bilingual teams. We sell to health plans, health providers, community-based organizations, and social service providers, and other digital health companies. To demonstrate how Pear Suite works, let me introduce you to Anne, a 65-year-old resident of Princeton who is challenged by a lack of transportation and stable housing. For community health workers supporting Anne, this is like a CRM for them. Our platform tracks and drives activities to ensure regular and appropriate engagement to address social challenges. The web-based platform includes an omni-channel communication system to reach Anne by phone, and we can also use texting and emailing to keep Anne engaged. Logic and AI-driven smart scripts guides users to ask the right questions at the right time, and our platform really drives this relationship, filtering trust along the way. Data automatically document C codes and encounter metrics for billing, while suggesting culturally sensitive and geographically appropriate resources and services for Anne. Let's connect Anne to some transportation service. Goal templates go beyond traditional care planning to track key activation steps, which are critical to promoting self-efficacy among community members. An actionable dashboards help community health workers prioritize how best to help Anne. And care flows provide real-time support, as you'll see next. Here, we're helping Anne get onto the Affordable Connectivity Program to help her get broadband so she can utilize telehealth services. What makes Pear Suite so special is that our platform is fully customizable, including our documentation and population dashboards, which you'll see next. These can display key organizational metrics and help managers coach teams be most effective and person-centered at the same time, which are critical elements of a cost-effective and sustainable social care program. Our builder tool allows organizations to create their own assessment tools, screenings, care pathways, and recommendations. And this is all meant to provide the person-centered and localized approach that we know organizations need. The platform becomes even more powerful when you add actions such as automated text messages, new goals, follow-up calls, and every aspect of the care journey, saving staff time while boosting engagement. With the Pear Suite platform, organizations can increase member engagement, boost health outcomes, drive revenue, and reduce healthcare costs. We've had great success along the way, being able to allow organizations to achieve 62% engagement rates. And our users love using the platform, expressing 95% satisfaction and increasing efficiency by 3x, which is huge. That alone can increase ROI and save organizations lots of money. Since launching in 2021, we've supported 24 organizations and impacted over 25,000 lives. Our flexible infrastructure, unlike other software solutions, allows us to integrate with other solutions like EHRs and use any kind of assessment tools and be fully compliant in other ways like SOC 2 and HIPAA. We're excited to share that we also have new health plan and health provider contracts, which we'll be implementing in over 70 new organizations in the next year. Pear Suite is backed by some amazing investors working at the intersections of building good technology and improving health access and equity. And because we know our platform can enable health organizations across the country and other care settings, we would appreciate any introductions to any of these types of organizations, as well as to subject matter experts who can help us change the way we address social care. At Pear Suite, we know that building strong trust relationships are the key to addressing every other social determinant of health. And with our platform, we can address these for thousands of other organizations across the country. Thanks so much.
Colby, thank you so much for that presentation. Amazing traction. I think one of the things I really want to focus on is your growth. I mean, you mentioned you're in 24 organizations now, and that slide with the 70 plus organizations that you're adding this year really sticks out. How have you been able to secure those commitments, and what areas are they in?
Yeah, we've been able to build some strategic partnerships with some large health plans across the country. They recognize that they can't handle social care needs alone and need to work with community-based providers and other organizations in the community to address things like housing, food insecurity. And so they're actually going to be paying for this software to be used by community-based organizations across the country to take advantage of Medicaid reimbursement, as well as other value-based contracting.
One of the things that we don't hear a lot about in the Medicaid space is user experience. And it seems that from your information, your users really love using your platform. How have you focused on that experience and gotten those types of satisfaction scores?
Sure. During the pandemic, I actually taught some community helper courses. And that was the first time I actually learned about this great profession. I got to work with a lot of these community health workers alongside them, people that weren't even called community health workers, but were doing this work. And they helped us develop this from day one. We continue to work with universities and training programs to work alongside them to get their feedback and really build from a perspective of them. What do they need? What are their interests? How can we help them do their job better?
So one of the things that I've been reading a lot about lately is a physician shortage or other types of clinical team shortages that are in market. I think one of the amazing things that you're doing is really helping to solve what is the new vanguard of healthcare worker, this community healthcare worker designation. What excites you about building software for that community?
Yeah, we're seeing more and more community health workers being employed by health plans, by clinics, by provider groups, by online groups like Othello and other groups that are doing work in care coordinations. We're seeing this population, this growth of this workforce really pick up. And with it, we're going to be able to give them better wages, make them provide training pathways for growth. There was $200 million invested in community health workers by the Biden administration. And we're seeing them really being a workforce that can be included in team-based care models. We're excited about that.